rotations throughout the year. It is your community block, so it's your community-orientated block, and we go to various sites. We work across the lifespan. That would be from birth till death. Not to sound dramatic, but the reason I say that is to make you understand that we will be working at clinics like Msindwana. You will be doing health promotion talks. You will be providing early intervention services with mothers. You will also be engaging with local health nurses. And you will also be involved in working with the antenatal classes. So providing education to moms, if we're talking about the first 1,000 days. What you will be exposed to coming to Ukwanda is awareness of national health and provincial health policies. To sensitize the students so that you're aware of what happens at community and what is ideal and what is not ideal. Cameron has also spoken about resource-constrained environments, being creative and innovative in an environment where you are limited for resources. One of you mentioned issues around language. You will meet clients and patients who speak Swahili, Shona, Xhosa, Zulu, English, Sesotho, because the environment actually caters for those clients. What is also wonderful is that you will be learning South African Sign Language. I'm speaking to the speech language therapy students. However, NID, National Institute for the Deaf, actually resides within Worcester, and therefore, as health professionals, you can access a 250 Rand online SASL beginner's course so that you know how to work with persons who are deaf and be sensitized with working with persons who are deaf. Just coming back again to what we offer speech language therapists on the platform. We work with speech, which is how you would communicate in terms of just sounds that are being made. So we work in ECD centers such as ASD, Association for Sensory Disabled, Association for the Physically Disabled, and this is working with learners who are young, up to the age of 18, who may present with some form of disability. In working with those learners, we work collaboratively. So at a site, for instance, if we don't have physios or OT, students are welcome to present a particular client or learner to collaborative care, and through that process provide access for that learner to other interdisciplinary services. And it's been wonderful to see even mid-phase students actually interacting with speech language therapists. We also access Huis Ebenezer with the physiotherapy students in collaboration, and that is quite a different experience for students because it's adults with severe to profound intellectual disabilities, which is something a lot of people don't come across. So they might have dementia, they might have cerebral palsy, Down syndrome, autism, and you still have to provide some kind of intervention and care, and particularly training for the caregivers. We also provide oral rehabilitation, as in A-U-R-A-L, not oral, oral rehabilitation for the deaf, that is at the schools for the deaf, Delabat School, Niverwip, as well as the NID College, which is a college for adult learners with hearing difficulties or impairment, learning technical skills. And there we teach them, or we train them to do speech reading, which most people will assume, okay, which most people will assume is very, very easy, but it's not. So the students also provide speech reading to those students so that when they do come out of college and have to engage in an occupational environment, are able to communicate with the hearing world. It is a daunting task as well. We also work with mainstream ECD learners, that would be advanced neurses and nearness, where we conduct early intervention services with the creches, and these are farm-based creches. And it's wonderful to see how students come up with creative projects to provide training for caregivers. And we also conduct a mobile health outreach with Department of Health into communities that are even further away from clinics to provide early screening and intervention. That is part of the COPC, Community Orientated Primary Care, which speech language therapists always think, but that's not really my role. So what you get in community is really to be exposed to the different levels of healthcare within the system, from the lowest level to obviously your highest level where we provide continuity of care. And during those visits, it's just once in the rotation that you get to experience that. And what's exciting about this, the current rotation on the platform, we're actually going on the provincial health bus. That's the big bus, which has the dentists and the nurses and the medical doctors and everybody going out to do outreaches. So we have some really exciting things that are going on in the platform. We also get involved with OTs and physios if they have a referral within the sites or the community that they would like some speech language therapy intervention. But most importantly, what I really want to reinforce is that within this context, we work very closely together. We also really encourage the use of ICF, which I'm sure all your coordinators will speak to you about, International Classification of Function, because it is about providing optimal quality of life to our clients that we see. Definitely come and engage with us, ask us more questions. I do have a full-on presentation of the other various sites that we go to, like Pioneer School for the Blind, as well as, what else? I'm just trying to think, sorry, please bear with me. We have about 12 sites that we actually go to in Worcester, but the students don't go to all the sites, they split up into two, so they go and rotate throughout the sites. It's very interesting times ahead, but particularly being aware also for speech language therapists is around the issue of quality improvement projects, which have primarily been very much the role of the medical students or the nurses, but also being aware that within speech language therapy, we need to provide quality improvement projects and services. Thank you very much.